Good afternoon, and thank you so much for joining us today. This is Talking It Up Thursday with Sandra and Cassandra.
Hello.
And we welcome you guys today, and thank you so much for tuning in. And it's our hope that when you view this taping, that you get some education and hopefully you'll make some changes, some health changes. Again, my name is Cassandra Jackson. I am the project coordinator of the Breast and Prostate Peer Education Project Program. I know, such a long name. We are a grant-funded program through the state of New York Department of Health, and we've been around for about 4 years, going into 5 years. Our goal and our focus is to educate women and men about the importance of breast and prostate screening. So how do we do that? We educate men and women. We go to do presentations. We go to food pantries to help out with food distributions. And we link individuals back to services, whether it be a primary care doctor, whether it be transportation, and whether it be a mammogram screening. Because again, that's what we want to do. We want to educate you to be able to get your screening. Did you know that women 50 to 74 should be having their mammogram every 2 years, or depending on what their doctor says? And so that's what we do. We go out and sometimes we do PowerPoint presentations, sometimes we do slides, sometimes we just talk. And now with COVID, we found ourselves being sometimes outside doing presentations, and we're doing Zoom presentations as well too. So Sandra, she helps us out a lot. She does the breast portion with this program. So she'll talk a little bit about what she does shortly, but we just want to make sure that you are engaging and doing what you need to do to be healthy, to be safe. I know some of you are probably thinking now, is this a good time to get a screening? Well, absolutely, yes. We know that COVID has stopped a lot of things. It stopped a lot of process, and it stopped us from doing a lot of things. However, we still have to be mindful of our health. We still should be doing our breast self checks, and we should still be talking to our doctor. Men as well. Men get breast cancer also, and we want to make sure that you know your family history and know what's important to you. So again, Sandra's going to talk a little bit about October and what's coming up next, and we'll just jump back and forth and just do some talking. So
Absolutely, we'll talk it up. My name is Sandra LaRoche. I am a breast cancer peer educator here at Niagara Falls Memorial Medical Center, and it's really nice getting out into the community, talking with people face to face, finding out what the barriers are that are keeping people from going out and getting their cancer screenings. So, as we know, October is Breast Cancer Awareness Month. We all see the pink ribbons, but it's more than just a month. Breast cancer can happen at any time throughout the year to anybody. While we do encourage women 50 to 74 to get those breast cancer screenings, we're seeing women in their 20s getting breast cancer. So it's really important that you know the signs, symptoms, and risk factors, and through this series we'll be discussing all of that. Today I wanted to just give you some information about breast cancer going into Breast Cancer Awareness Month that everybody should be aware of. Breast cancer is the most common type of cancer in women, and it's the second leading cause of cancer death in women after lung cancer. Black women are more likely to die from breast cancer than Caucasian women, although more Caucasian women will get breast cancer. All women and men also, as Cassandra said, can get breast cancer, but it's most frequently found in women ages 50 and older. Some of the things that increase your risk factors are your age, your race, and your family history. We have no control over those things, but it's really important that everyone knows their family history or does their best to research this, find out what's going on, find out if there is high rates of cancer in your family, because that's going to put you at a higher risk. But here's the good news. Nearly half of all cancers can be avoided through positive lifestyle changes such as visiting your doctor regularly. If you don't have a primary care physician or an OBGYN, we can assist you. We've got a great staff here at Niagara Falls Memorial, or we can direct you to somebody that may be more conveniently located to you. Exercising regularly, that's another important part, and eating a healthy diet and not smoking. Ladies, we spend all this money on creams to look younger. Give up those cigarettes. You'll get rid of those wrinkles around your lips, or you can avoid getting those. So that's just another perk to it. But the most important thing is get out there, talk to your doctor, find out when you should be getting screened for breast cancer.
And we do know, too, that 1 in 8 women will be diagnosed with breast cancer in their lifetime. And right now, nearly 40,000 women have died annually from breast cancer, too.
It's too many.
It's a lot, especially African American women, Hispanic women. All women should be getting screening. I know some people say, you know, oh, my breasts are too small, I don't need to get a mammogram, but you should be getting a mammogram. Women, we are wives, we are mothers, we're sisters, and we have friends who love us and need us. And so it's important to get that screening. Women's lives matter as well. And so we just want to encourage men to know, men and women, to know their family history. Because again, I know for me, it took a long time for things going on with myself, and I would call my mom and say, hey mom, such and such, this is going on. And she would say, oh yeah, I had that too. I'm like, well, when were you going to tell me that? You know, I needed to know that too, so I can let my daughters know the same thing. But
Exactly.
It's just hard. So if breast cancer does run in your family, and if it doesn't, you still just want to make sure that you are knowing what's going on in your family and why it's important to have that conversation with your doctor. Because again, between you and your doctor having that discussion, you will know. You can make that right decision for yourself. And so we just encourage everyone to get a primary care doctor. So.
And I do have some exciting news to share with all of you. Here at Niagara Falls Memorial Medical Center, we are going to be having a mammogram event. So keep your eyes open for some pink pumpkins that will be coming out soon. We'll be selling t-shirts at a reasonable cost so you can show your breast support. Anything else?
That would be all for me.
I have one more thing.
Do you?
I have a question for you.
For me?
I do.
Oh, goodness.
What do you call a group of bees wearing ghost costumes?
Let's see. A bee sting. Bee up. Boobies.
Boobies. On that note,
So
thanks for joining us.
Yes, and ta-ta for now.
Ta-ta for now.